Tinnitus, ear ringing can be overwhelming, and most doctors don't give you great advice. That's why in this video, I'm breaking down the most frequent concerns people have about sound therapy for tinnitus treatment, and I'll give you clear, science-based answers. Sound therapy is one of the most effective tools we have to treat tinnitus. It's a cornerstone of tinnitus retraining therapy, a proven method that helps your brain habituate to the sound of tinnitus so it fades into the background. I'm Dr. Ben Thompson, audiologist and founder of Treble Health. My team and I have helped thousands of patients reduce their tinnitus. We're a nationwide private practice. Let's jump in to question 1. Will sound therapy make my tinnitus worse if I use it too much? So the answer to this question has 2 parts. One is about the duration of sound. The second is the volume of sound. Is there too much of duration? No. You can use sound therapy for as many hours a day as you need, and you can also use it for months of the treatment period that is recommended by your audiologist. For example, for someone with a serious degree of tinnitus and they've had it for, let's say, at least 3 to 6 months, then I most commonly see their treatment window is between 6 and 12 months from a full window perspective. But they get better through the stages of relief and the stages of treatment, slow, consistent improvements during that period. Now for the volume of sound. Here there is too much. You want to understand the level or the loudness of your tinnitus. You want to use sound therapy like white noise, pink noise, or sound relaxed tones inside of these Widex devices that we commonly recommend to patients. Any of those can be used as sound therapy, and you would play that underneath your tinnitus so the sounds can mix in with the tinnitus. If you have the sound therapy too loud, where it fully masks or covers the tinnitus, that's bad. That will be too much sound therapy, and that can potentially make your tinnitus worse or hinder your progress for it to get better. Question 2, should I use headphones or speakers for sound therapy? My recommendation for the best sound therapy treatment would be devices that can go on the ears like these and can be used as sound therapy devices. I'll put an image on the screen right now of me wearing these Widex Smart Rick devices, and you can see they fit up and behind my ear. Widex is a hearing aid that we're using for sound therapy, and other brands of hearing aids can be used as well. We have access to all of them here when we work with our patients. But that's the ideal setup because the sound therapy stays on your ears and it's set at the correct volume and the correct sound quality of the sound that we're using. And then you would go and live your normal life. Anytime you're in a quieter environment, the sound therapy would kick in automatically so that you don't have to adjust and mess with a Bluetooth streaming or an app or low battery life. So if you're considering, oh, well, I'll just use headphones like AirPods or over-the-ear headphones, I don't recommend that because number 1, it blocks and plugs up your ear canals. That's a big no-no. The sort of 101 sound therapy treatment would be keep your ear canals open. So using devices like these would be the best route. You could also use a speaker, a high quality sound machine that plays the sounds, except everyone in the room you're in would hear it. Potentially you could experiment with bone conduction headphones, although there's a lot of downsides to that, which I won't get into in this video. Question 3, is sound therapy just replacing one annoying sound with another? No, it's not. Sound therapy is not a crutch. It's not something that you use to distract yourself. It's a tool that helps you retrain the auditory brain. There's a protocol that I'd recommend that you learn about called tinnitus retraining therapy, and I'll teach you basically what it is. So your auditory brain had some level of brain buzz or electrical noise in it. Everyone experiences some degree of tinnitus. That's like a phantom sound in the auditory brain, right? That was already there. Some element of that was already there. And the auditory brain has a filter, and that filter is designed to suppress or reduce the awareness and volume of this neutral body sensation, what's going on in the auditory system. But when the filter can get out of balance, then the same buzzy sound or ringing sound in the auditory brain, when the filter is weakened, the sound becomes louder and more intrusive. So we need to reverse engineer this system, and I'd recommend using tinnitus retraining therapy as a foundation of how to do that. When we use the tools as a part of that protocol, the filter can go back to homeostasis, and the patient experiences significant relief and like their life is back to normal. Sound therapy is used during that treatment window, during that treatment period. Once the treatment is finished and the patient is in a much better place, they don't need to use sound therapy on a daily basis. They're done. It's similar to having a knee surgery, and then you need to use a knee brace as well as do your physical therapy. So with tinnitus, I'd recommend using the sound therapy devices. This is like your knee brace. It's not a crutch, but it's a tool that actually helps you rehab and get better. And then also simultaneously doing for the knee, you would do the physical therapy sessions. You need both of those to succeed. With us, you have the sound therapy devices as the knee brace example, but then the one-on-one sessions where we're working on the counseling, coaching tools, getting us out of the anxiety response, calming our nervous system, working through the actual struggles of how does this impact your day-to-day life, what is going on between your ear and your brain, and those kinds of coaching or counseling methods. That's like the physical therapy, right? So if you can do both the sound therapy devices plus the one-on-one coaching counseling sessions, then you are following the protocol very well. You are very likely to get better. Question 4, how long should I use sound therapy as a part of tinnitus treatment? My recommendation from all the patients we've worked with is try to get at least 6 hours a day of consistent sound therapy use and try to do that for 6 months or more. That's a good average recommendation for all the patients we see, but each one of you is individual. You have different lifestyle, you work in a different job, or you have a different type of home environment. You also have had tinnitus for different periods of time. So we might recommend a longer tinnitus treatment period and set those expectations up front. If you've had tinnitus for a lot longer, or if you've only had this for 2 weeks, then we might just be looking at a shorter time period for your treatment. Question 5, what's the best sound therapy app or setup to get started with? My recommendation would be ear level devices from my team at Treble Health. I have some examples of ear level devices right here from 2 different manufacturers. The key thing is to understand what exactly do you need with your tinnitus? What is the sound quality of your tinnitus? How does it impact you on a day-to-day basis? Do you have any hearing loss? And what have you tried so far in terms of sound therapy? When you share all that with a specialist on my team, then we would provide the detailed recommendations for your treatment, something that's personalized to you. There are various devices that can work for tinnitus treatment, so it is best when it's recommended on an individual basis. Additionally, I see success with high quality sound machine that can be used, one that does not rely on Bluetooth. And then finally, iPhones have something called Apple Background Sounds that can play sound therapy through an iPhone as well, if someone was looking for a quick way to get started. So with all this in mind, I'm here to answer and help you guys. If you have more questions that you want me to answer in future videos, please drop them in the comments here on YouTube. If you want to reach out to my team at Treble Health, then you can click the link on the screen right here to ask some of your questions to a real human who can answer them and then guide you towards the best treatment possible for your tinnitus. Separately, if you want to learn about ear level devices and different hearing aids for tinnitus, how that can be used for your treatment, check out this video right here where I discuss the most important features of a hearing aid for someone with tinnitus. My name is Dr. Ben, and I'll see you in the next video.